Good morning and Assalamualaikum warahmatullahi ta'ala wabarakatuh. So by the way, I am RACMAN SODAIS. So today I will be presenting my case study, which is bipolar disorder, the case of the patient. Submitted to Ma'am Normalia Goro, RN and MAN. So before I start today's case study, what is bipolar disorder? So, a bipolar disorder is previously known as a manic depression. It is a mental disorder characterized by period of depressions and abnormally of elevated mood that each lasts from days to weeks and in some cases are months. So, what is the psych history of a patient? So, these are initials names of a patient. GSM, age 37 years old, 6, male, civil status separated, nationality Filipino, and also religion Islam, and address Sagunsungan Shelter, school level Sikanyar High School, occupational none. So what are the chief complaints of a patient? So aggressions, behavior, and disorganized, history of a present in illness, onset, first symptoms appeared at age of 15, including the poor hygiene, refusal of taking a bath, and also social withdrawal, wearing multiple layers of clothing, and rope tying. So what are the participating factors, separations? Predisposing factors is family history of mood disorder, premorbid personality, quiet and sensitive. What are the past illness? Psychiatric or diagnose the patients at 15 years old, rehab once. So medical, no chronic illness, alcohol and substance use history, denied, family history, amnesia. So the prenatal and perinatal normal delivery, early childhood, normal development, quite and attached to mother. Late childhood are working. Number D, adulthood, change behavior. Number F, sexual history, no sexual activity. Number G, fantasy, dreams, he had a dream. And also values, kind, loving son to his mother. So, occupational story, PKF security and emission. Matagal na siyang PKF sa emission. Marital and relationship history, separated to his ex-wife, to her ex-wife for almost 17 years. Military history, no applicable. Educational history, strong until grade 8. Decline due to change of behavior. Religion of the patient, Islam. Social activity, outgoing during high school, withdrawn during lows. Legal history, arrested by the police for violating for COVID protocol due to kanyang illness na, no? So, what is the MSC? Mental status examinations. So, appearance, chubby, light colors, clothes, wearing of patients, and good hygiene. So, speech speaks calmly, mood of the patients, relaxed. What are the thinking of patient? Flight of ideas. Perceptions, no hallucinations of a patient. Sensorium, alertness, upper alert. Orientations, oriented. Concentration, focus. Memory, immediate interact. Intact. What are the calculations? Good, well answered naman. So, abstract thinking, concrete and thinking. Insight, denies illness, judgment, cooperative naman yung patients. So, what are the psychodynamic of a patient? Or by psychosocial development by Erik Erikson. So, Jalal is currently 20 years old. GSM, Jalal is currently between 20 and 40 years old, which is navigating Erikson theory, intimacy versus isolation, so stage. So this development period is focuses on building strong, committed, and relationship. Successful forming these bonds foster deep connections, while failure can lead to feelings of loneliness and isolation. So that's why nagkaroon tayo or napasok dito yung navigating Erickson, which is intimacy versus isolation due to loneliness and isolation of a patients. So Jalal is failed marriage and current social isolations point to struggle with intimacy. Suggesting is learning towards isolations in Erickson framework. His lack of father figure since age 2 may have negatively impacted earlier development stages. Hindering the development of trust and autonomy, these early deprivations like contributed to trust issues. Nagkaroon siya ng issues, poor emotional and regulation. So, unattachment problems, no manifesting and aggressions of relationship difficulties. So, ace aggressions may be defense of mechanisms stemming from unmet emotional needs and abdomen anxieties and insecure attachment. So, continuing to affect is adult relationships, no? So, what are the signs and symptoms of patients? So, isolations and withdrawal from social contact, fair mood with intermittent episodes of agitations, report of tantrums lasting several minutes to hours. Nagkaroon siya ng tantrums. Separations related to emotional distress. No hallucination or delusional noted naman. No sense of suicidal or homicidal ideations of a patient. Hindi siya nagkaroon ng ganong symptoms. But there is symptoms of hallucinations. What are the medical management? So, treatment types of examples is purpose, mood, stabilize lithium, valporate, control mania, and prevent relapse. So, antipsychotic, which is this, olanzapine and risperidone. So, this one is treat mania and psychosis. Antidepressants, fluoxetine with cautions, nagmamanage ito ng depressions. Psychotherapy, CBT, family therapy, support and coping skills. Hospitalization refers to self-aware of severe episodes. Of nakaroon siya ng episodes na ganun. Lifestyle support, sleep hygiene, and avoid stress and drugs. So what are the nursing managements? So nursing management is first is you need to assessment, monitor for early signs of aggressions of agitations, assess by psychosocial background and emotional triggers. Kung ano yung nakaka-trigger sa kanya, you need to assess it and evaluate the compliance with medications of therapy. So what are the planning? So the planning is stabilize trust and therapeutic communications. Encourage verbal expressions of emotions rather than physical actions. Develop routine to reduce stress and anxiety. So interventions provide safe, non-simulating environment, reinforce coping mechanisms, and relaxation techniques. Set clear boundaries and limit regarding behaviors, and educate on the importance of treatment compliance. Evaluations, reductions of frequency of aggressive episodes, and also improve social interactions and verbal communications, medications compliance, and attendance in therapy. What are the recommendations? The first recommendation is psychiatric follow-ups. If nagkaroon siya ng if na-diagnose siya ng psychiatrist. So, regular consult with psychiatrist to monitor progress and adjust medication as needed. No? Family involvement, educate family about the condition to promote understanding and support para magkaroon ng why we need family involvement is due to para magkaroon ng understanding doon sa patient, ano yung kalagayan ng pasyente, so that masuportaan yung pasyente kung ano yung mga kinangailangan ng pasyente. Social integration encourage the perceptions of structured group activities to rebuild social skills. Vocational supports explore program that offers skills training and employment for individual with mental challenges, health challenges. Long-term goal, empower Jalal to regain emotional balance, to reduce isolations and develop healthy coping mechanism. So what are the drug study of a patient? Or what are the drugs that taken to the patient? So first one is this risperidone. The generic name is risperidone. Brand name is Risgen. Classification is antipsychotic. Dosage frequency 2 milligram once a day, once daily. Yan. Mechanisms of action: blocking dopamine and orthoreceptors and serotonin, 5-HT2A receptor in brain. Indication: bipolar disorder or schizophrenia. Side effect: constipations, weight gain, increased appetite, and anxiety. What are the nursing responsibilities? First is you need to monitor the behavior and mental status. What are the extramarital and symptoms? So the next medications is beperidine. Generic name beperidine. Brand name Akidin. Classification: anticholinergic. Dosage of frequency 2 milligrams a day. Mechanisms of action: blocking acetylcholine receptors in the central nervous system. Indications: Parkinson disease, extrapyramidal symptoms caused by psychotic drugs. So side effects: dry mouth, drowsiness, nervousness, blurred visions. Nursing responsibilities: monitor for therapeutic response, assess for anticholinergic side effect, monitor mental status. The next one is the valproic, which is the last medications of a patient or the drug study. Valproic acid, sodium valproate. Generic name: valproic acid, sodium valproate. Brand name is Valprox. Classifications is mode of stabilizer. Dosage and frequency: 500 milligram TID. Mechanisms of action: inhibitor, neurotransmitter in the brain. Indication: bipolar disorder. Side effect: nausea and drowsiness, dizziness. Nursing responsibilities: monitor liver functions before and during therapy. Assess for unusual bleeding or bruising of may pakikita. So that will be all my drug study and also my case study. Thank you so much.